Hi, Sujana. Hi, Sujana.
Sir, sir, live is on.
Okay, fine. Okay. Hi, guys. Good evening. It's about 5 o'clock. So I'm just waiting for that 1 minute here. So, like you all know, congratulations for all the rank holders and to be rank holders. Um, First thing is, I get a lot of messages from few of the students asking what seat to take, what is gastroenterology worth it, is some other subject okay, comparisons between too many things. So, hi, Dr. Suraj. Hello. So, I'm running a parallel session here. So, one is on Zoom and which is telecasted in YouTube Live. So there may be a small lag, but however, most of your questions will be answered time and again in due course. So first, I have jotted down the common questions that are being asked by students and try to put in my perspective for how to go about this particular problem. So let me go to the common queries that are asked by students. If I remember in 2018 or 2017 is the time where there was a similar pattern and a student was able to take any subject of their choice in that particular group. Now that wasn't there again for some 2 to 3 years, and then now again it has come up. So the most important first question for many students is, sir, I have got a very good rank. Everything is open for me. So I was interested in this particular branch, but now I am inclined towards this branch as most of my relatives and close friends are telling this. Now, see, this is crazy. See, it's a genuine question. Your rank should not be telling you what to take. Okay, by the time you have completed your MD course, I feel that you should be able to, concentrate on or focus yourself on some single subject so that it's easier to take. But however, when you get a very good rank, you are suddenly in a dilemma whether to take this branch or that branch. You would not want to, kind of regret later in life. So, first thing is just to tell few students who are at this stage of the question, that is, you have got a rank, it is good, and you are confused in what to take. For these kind of students, what I suggest is, first thing is, during your MD time, you would have had some external postings in different branches. So see what you actually liked in them. In some of the colleges, there are no special postings in some branches like infectious diseases, rheumatology, some other branches like these, where it is difficult to make a choice. They probably didn't have a branch, or they had to go somewhere else, or they bunked those classes that time, which is quite common. So it is difficult to make a choice for this, but especially these set of students, they wouldn't have got exposed to their branches. Some hospitals do not have oncology, so it's very difficult. They're an entirely different branch. To ultimately decide whether to take it or not is a big question. So what I personally suggest is, during your MD time, you would be definitely inclined towards a branch. And if not, you have to be exposed to a branch to really know that whether that suits your personality. There are some who would want to be more attached to subjects which are more towards medicine, like say nephrology, where you still are happy interpreting the ABG and make clinical decision on that. Infectious diseases, where you have entire panorama of the entire human body being included in the decision making process. Or there may be few of you who are more interested in branches which are interventional. Now interventional branches are for medicos. There are few, like cardiology is an interventional branch, gastroenterology is an interventional branch, hepatology, which is again a component of gastroenterology, has some interventions. Rheumatology, very few intervention. Endocrinology, no intervention. So you would be able to divide yourself what your passion is based on these two questions, whether you want predominantly medicine based thought process, or whether you want an intervention, or you want a club of both of this. I would, if you ask me, for gastroenterology, if you ask me, is it a very interventional branch? I would say no, it is definitely a significantly medical branch, because you have to still use your thought process when a patient comes to you with hiccups, vomiting, abdomen pain, nausea. You have a diversity of organs which you are thinking about, may it be from mouth to anus, pancreas, liver, spleen, any abdominal organ. So you have a diversity of causes that you're dealing with in a differentials. And of course, there is a mix of interventions which can range from endoscopies, colonoscopies, ERCPs, endoscopic ultrasounds. Of late, we have advanced procedures like enteroscopies to evaluate the small bowel, capsule endoscopy. There are procedures which comes under nodes, where we get to do poems, third space copies. So these are, it's a growing branch. Okay, a lot of things happening. On one side, you have hepatology, which is a counterpart of gastro, where predominantly whoever takes it are more towards transplant hepatology. So as a branch, gastroenterology is a mix of many things. It's not focused into one thing too much, but however, you can choose to do that after your DM if you want to subspecialize into something special. Okay. So I would say gastroenterology is a subject of mix of so many types of patient presentation, thought processes, procedures, and a lot of things. Okay. So first question is, for some of them, should I take gastroenterology just because I got it? No, that should probably not be a waste. You should probably be exposed to the branch, or at least know about it through some of them like us, to have an idea of what exactly you get to do. Okay. If you're exposed, that's the best. Then you can choose between whether it really you liked it, or you are just taking it because somebody told. Okay. So you might have a lot of hurdles before making such decisions. There are a lot of perceived myths about the branch, which is what I would want to bust. First thing is, it's not a purely interventional branch. There's a significant medical thought process which goes on. And having an interventional part for a branch is always kind of more lucrative with respect to, easy generation of the capital also. Because just OPD based management doing rounds may not be that times that rewarding at times. A procedure, when you do something, you have that little feel of, yes, I achieved something. Second, there are a lot of research work possible in these branches also. And that is one added advantage. And it also has diagnostic component to it. Significant part of the investigations that go on, or the luminal investigations that go on, all deal with diagnosing the condition. We also have a radiological interpretation where CT scan, MRIs can be interpreted, and EUS, endoscopic ultrasound, is like an amazing investigation where we get to put the probe inside the lumen and do some advanced imaging inside, and even do intervention based on that. So I would say it is an amazing mix of so many types of interventions that goes on. Second question that students ask is, sir, now gastroenterology and hepatology, I'm confused between what to take among these two. I like both of them. Or I'm too worried, sir, in gastroenterology, there are a significant number of surgeons also who are doing endoscopies. So will the competition be too high? Second set of students are there who tell that, sir, gastroenterology, it is very easy to set up in a peripheral center and still run a price practice because I also get to see liver patients. But for a hepatology, it is difficult. Will I be able to manage a gastro case or a luminal case? This is a genuine question. Now, when comparing between gastroenterology and hepatology, there are some institutes like say CMC Vellore where gastroenterology and hepatology almost go hand in hand. There is no difference between the two branches. There are some hospitals where hepatology is completely different. They totally don't deal with GI procedures or anything at all. They completely focus on liver, totally liver and transplant hepatology. Now, usually it's true that for a gastroenterology person, it is easy to set up in a peripheral place and start a center. Whereas for a transplant hepatologist, it may be difficult because our country is still not open enough where we have transplant facilities at tier 2 or tier 3 places. Okay, only in metropolitan cities we have that facility. So it may get soon saturated if the number of students get into hepatology. That is a genuine fear. But I've seen the other way also. I know students, few of my friends who are into hepatology, who have gone out to periphery and have a very good gastroenterology practice. They manage CLDs, and the transplant of their patient happens in a metropolitan city where they are involved, and they go back to these doctors and they manage the cases again. So there are examples on either ways. So branch-wise, I would say hepatology is more of a medical branch where thought process matters a lot with less of interventions. You, of course, will be doing endoscopy and banding, and maybe if you're trained at few places like ILBS, you may also learn how to take liver biopsy, transjugular, or you may also know how to do a HVPG and other added interventional stuff. So it depends on place to place again. So I would say both branches has its own pluses and has its own minuses, but the minuses are more, if you feel, then you should sway towards the branch which suits you. Research work, there are enough to happen in both these places. Okay. Second, guys, if you really have any specific doubts, please put up in the live chat box so that I'll simultaneously see that and try to answer if there's any different question apart from these 5 common questions that student asked. Third question is, should I take DM or DrNB? What are the pros and cons of each course? Now DM has traditionally been taken by a better ranked student, and DrNB, which was initially called DNB, was generally available for a lesser ranked student. That's how the trend was. But off late, with new intrusions like bond at few places where there is DM, there are no bond in DNB, changes the equation a lot. So if this happens, then the question of where to do what has changes a little. Now, DM traditionally though was considered superior, but if you do a DrNB from a good place with a lot of facilities where you get exposed to different kinds of tests and diagnostic tests, it is still a very good choice. There may be DM places at few places where you don't get exposure much. There may be patient overload, but to some extent you may not be doing the advanced things. So that also can happen. So either ways, I would say that, see, it is a course for life. So preferably try to choose at the best place. If not, at least you get the seat. You have decided that it is your choice, take the seat. After 3 years, there are again fellowships. You can do work under a senior gastroenterologist who might be expert into some subset of gastroenterology, and you can build your passion over that. So if you don't get a seat of your choice, it doesn't mean that you take some other seat. If you're still passionate about gastroenterology and you could not make it, there's always a next chance. Okay, so that's important. Now, what are the pros of DM? Most of the time, what I've noticed is in colleges where DM is going on, it has a more organized and structured research work, the academics going on. That there's no second thoughts about it. Now, in places of DrNB, majority of the places, it's a hospital-run place. Few places do not have academics. So you please inquire from the students how it is. Third, when it comes to research work, generally DM related places have a better research program going on, grants being awarded, and things like that. But there are a few places where DRNB, like AAG, where there are a lot of research work going on, and a lot of works going on. So these are things which you have to question yourself before taking a choice. Then comes the number of students. Yeah, the number of students who are with you can help you while going across a course. But if the number is too much and it is an interventional branch where you have to learn some soft skills by procedures, if you have too many students also, it can be detrimental. That's what I would want to tell you. There are some places which have one student or two students where the workload, even if it is less, it becomes too much for the student. They're unable to take leaves. It's just too much on them. So you have to have a fine-tuned balance between all of them. A good number of students, I would say, if you have a decent IP load, OPD load, good procedures happening, good research work happening, and you have at least minimum 4 to 5 other colleagues with you, there will be rotational duties and it may be very good. And also make sure how the professors are. Usually a place with open-minded professors, it may be easy to sail through the entire course of 3 years. But however, you guys have all done your internal medicine from different places. You would have seen more toxic atmospheres. So it would probably not be new. We are more accustomed to seeing toxic atmospheres. There are some places where the workload may be just too high, and if you think that I want a place where life should be very easy, I want to just go have a morning coffee, then go and just start procedures at 10 o'clock, by 4 o'clock I should wind up, I should not have night duties, then probably it may be difficult to choose a place like that, because there are very few places like that. Usually you should have good amount of work, especially most of the places will have that in the first year. By second year, procedures and some therapeutic procedures start over. And by third year, you should probably be exposed to procedures like ERCPs and basic stenting. At least you should be able to handle cholangitis, if not a complicated case. If this happens, then everything is probably met. Some places have this bond, and significantly number of students are asking me, sir, will it improve my skills or it is just waste of time? It depends on where is the bond, where they will make you work. So this becomes really, really important. So I would say that bond for more than 1 to 2 years is waste. If you have more than that, it is waste. If you have 1 year and they are letting you train in 1 second, guys. There's no power, so I hope there is no. Okay, as far as I'm heard, then it's fine. If there's any disturbance, do put in the chat box. We should not have any disturbance. Yeah. So what I would want to was what I was trying to tell you is, if you have a bond, make sure you get to work in the gastroenterology department and you get advanced procedures. At least should not be same like your PG days. Okay, that is what you should make sure it's there. If there is kind of bond which is for too long, it doesn't make much sense. You should obviously get along, see the practical world outside soon, and establish yourself in a hospital or with some other team. So if you get a seat and it's for 3 years and you feel there is not much training and you have to learn something, always you have other places to go learn 1 or 2 years in your advanced procedure. So that is also important. So if you tell me the answer to this question again is mixed, I would say that if you are interested in a branch and you get it, even in an okay place, it's okay to do the course, and later you can always learn in places with higher volume and get exposed to advanced investigations like manometry and third space scopies, whatnot. There are a lot of things to get specialized into. And if you feel that a place is, I have got a place, but they won't teach ERCP by third year, should I take it or not? No, it doesn't matter. You take it and you can learn ERCP. After your DM also, it may just take 6 more months to learn those skills. So do not stop a place from taking it just because it is not exposing the students. So the ideal place will be that by third year, you should be knowing these basic stuff. Research should happen well, and you should come out colorfully to establish in a private setup and able to manage cases. Or you should, after that, learn and come into these lines. Okay, so these are the important things I wanted to share. And when it comes to choosing a college, I would say that follow some basic principles that if you are a married person with children, it would be difficult to be very away from family. So give importance to family and choose a place close to your house, or it is manageable to shuttle between your home and their college. That would be the ideal scenario. If that is not a limiting factor, I would say that if in India, anywhere it's possible, then the best decision will be to take probably a structured course like DM without bond. Then I would say that DRNB from a very good place can come over. Or the next option should be DM place with bond. And the last option would be a DM or DNB anywhere far. You just got a seat and you want to do it and complete your course. Now, this should be the order of things that you see. To know whether a place is good or bad, please inquire from those hospitals who have passed out or in their final year. They will be able to tell you the exact scenario about OPDs, IPs, the procedures, what are the different fields, whether they get to do research, are they sent to conferences regularly to update them. So the PG is the time where you would want to do all these things. Okay. So these are the things that are important. Okay. So to specifically choose a college, I think the best would be to contact me personally on WhatsApp. We can have one-to-one talk with the respective student and see what is the best scenario. Of course, you can ask some other questions pertaining to the subject or some personal problems which is not letting you take a decision and what to do. Now that I can talk to you personally on the phone. But overall principles remains the same. First choose the branch, then comes in the branch which college to choose. If not the first option, what is the better second option? What is the order of colleges I should probably go for? Now, majority of you have this doubt that if I have this rank, will I get this particular thing? But the best one would be 2017. If you have the rank sheet and what exactly happened by the third counseling round, that would give you a fair idea of what could happen, because there's not much change between 2017 and 2022. Still, the trend is very similar. However, you may have more seats now. So the chances of getting a seat may be better now rather than that time. Okay, these are few things you should know. Now, let me just read in through few of the questions that's been asked. Can I get a DM seat on rank 1400? Yes, you can get a rank. It depends upon the subject. If it's in Gastro, you will probably get in a place which is far off or with a significant bond where people may not choose to take. Okay, that kind of places, it may be possible. But however, there is more chance of getting DNB. Okay, let me read through the next question by Dr. Subrat Kumar Datta. He has asked, which thing to choose, Gastro from average institute or Hepato from good institute? Okay, Dr. Subrat, I would say that Hepatology is more medical branch. The subset of patients you see are very specific. It is totally transplant oriented thought process. You would not have many procedures which are as much as a gastroenterologist might do. So considering these two, I say that they are quite vast with respect to your lifestyle. Okay, lifestyle, you would not be able to settle in a peripheral setup if you want to be involved in transplant hepatology only. These are the criteria which will tell you whether to take in a Gastro from an average institute or Hepato from a good institute, because both because work-wise ILBS has quite a good tough schedule of work. That's what I've heard. So you have a lot of parameters which play a role. What I would have done is I'm somehow interested in Gastro and I've taken that. I would have taken Gastro from an average institute, but there are my friends who wanted hepatology, who are prepared for hepatology. They, on the other hand, have got hepatology in a very good institute and they have taken it. People are there who have, either ways things are happening, but it depends on you, what kind of thought process you want, less interventional, more thought process related medicine kind of a branch. Hepatology is what you should go for. Okay. Then can I get DM seat in government college at the rank of 991? Probably a DM seat in a government college with bond is still probable, and especially mop-up rounds, when you go that to that extent, no, things may change a lot, because by the time you go to mop-up round, too many things change. So there's always a chance in later rounds. Which thing to choose? Gas, yeah, that I have read. Then one more doctor has asked, so Dr. Saurabh, sir, suggest good institute at Hyderabad and Delhi. See, two very far off places. So Delhi, I would say that GB Pant is good. The exposure to procedures is good. Protocols may be a little different from different places, so let's not judge whether protocol is correct or wrong. There is no bond there. Okay. Otherwise, doing a DNB from a good place like Kangaram, or where the case load is good and protocol is there, is also good. In Hyderabad, I would say that medical colleges wise, Gandhi Medical College, Osmania Medical College, these are government medical colleges with probable 1 year bond, if I remember. And you have AAG, which is a phenomenal place, but however, the number of students are quite high, but the load is also quite good, but you get exposed to different types of cases. So either ways, it's good. There are some specific hospitals where good exposure to ERCP is also there. For that, you can please contact me personally. Then I'm ready to share some details, because I know about few places. Okay. Then comes the next question by Subrat. What are the DRNB colleges, friends, sir? That depends upon your rank. I would probably go with the Gangaram and AG in the topmost, and then I would choose the rest of them after them. Okay. Dr. Umair wants to ask, sir, do you have any idea about fellowships abroad? Or do they look at research work that you have done? Okay. See, fellowships abroad are there. Okay. Now, after your DM, fellowships abroad are there at few places like UK and other places, Canada. Transplant hepatology, pancreatology are there. Usually in Hong Kong also there's a fellowship, but these, the waiting period is more. Your research work definitely plays a role in these places. Suppose your research work is heavy, it's loaded, the chances that in the interview you may get across is easier. Okay, but I would personally tell that once we have done DM or DNB in India and you have learned basic things up to ERCP, to advance further, like advanced US or third space, you may prefer. But in India, we have enough places where training is being given quite well, and they are quite efficient, and students are quite happy with whatever they are doing. So you do have an opportunity to do fellowships abroad. There are quite good number, but the waiting period is more. So you have to start thinking about that when you are probably in second year of your DM or DRN. Okay. Okay. Yeah, research work does play. The next question is, what are the best options at 1,000? Okay, this particular rank, what are the best options? I would like to, talk to you personally. That would be a best thing that I can do, to specifically tell you what are the colleges that can help you. Okay, then when we are free, we can, a person to person talk is always better, because there will be more queries which we are something very good about a college and not so very good about other college, which I cannot be very open in this kind of platform. Okay, so it keeps me, crippled to answer the questions really to the best possible way. So again, a DNB Gastro for rank 1,700. Yes, of course, there's a possibility of getting a rank. It's not very difficult, but however, you might have to wait. There are lots of colleges, lots of seats of late with a general rank of 1,700. It's not just only in gastroenterology this rank is, right? So there are very good chances of getting a rank and a good place also. Okay, don't worry about rank sub 2,000. Nothing to worry, I feel. Next question: any preference of college in North India, sir? Again, you have to, I have to know your rank, and then I will be able to tell you what exactly is the preferred choice that you have. Okay. Then preference for gastroenterology in South India. See, Dr. Suraj, I'm not sure what your rank is, but if you ask me, you want a college in South India. How much is South is a question. So if you consider hospitals of really good nature, now we have CMC Vellore, where you have an entire new campus. You have a lot of new equipments there, students, a lot of caseload. It's very good. Then you have a lot of multiple government colleges around at Tamil Nadu, Kerala, a few at Andhra Pradesh, and a few at Telangana and at Karnataka. All of them are okay, average. And I would say that there are multiple places where are good DNB residency programs being done, especially at Chennai. And at Hyderabad. Okay, so specific details can be told on top basis directly. The other question is by Dr. Prashanth Gopal. Is there any difference of preference between DRNB and DM candidates when colleges or corporate hospitals hire doctors? Now, if you ask me what I've noticed is in corporate hospitals or in teaching hospitals, of late, there is no big difference between when they hire a student. For initial days for teaching, they were preferring DM candidates over DNB. In corporate hospital, generally they tend to choose students from probably from premier institutes. I have seen this, so I'm telling you. You might think other way around. Usually from premier institutes, if there are two students, they give more preference to guy from, say, AIMS or PGI, CMC, Vellore. They get preference over because of the wide variety and the variety of cases they get to see, and the institutes they were already in, so they get preferences. And some places also give importance to fellowships that you get to do and the research work that you get to do. But overall, in a simple corporate hospital that is running like any other place, that much preference is not given off late. But if you have a lot of gastroenterologists whom to pick up, then the where they did, what they did can definitely play a role. Okay, rank 143. I will please talk to me directly. We shall decide on the preferable hospital, because there is BHU, there is Jaipur, SMS Jaipur. There are some good DNB units also happening, but I would say I would use prefer for DM. Okay, then let me see. Are sessions like this also going to happen for other subjects? Most likely that similar sessions are going to happen over next 3 days. I think there are different consultants based on their free time, they're pitching in. So very soon you'll have for cardiology, for endocrinology tomorrow, which I know. Other subjects are going to happen by this weekend, most likely. Okay, so that's going to happen, guys. Yeah. So it's been an amazing opportunity for me to talk to all of you and share my views about gastroenterology, hepatology, how to choose a seat, and few aspects. Of course, there may be many doubts which as a solution, even I might not be able to talk in open forum like this. I would prefer that if you're able to message to me, then I will, we can choose a preferable time mutually and talk to each other and come up to a consensus on what exactly to be done. Thanks a lot for Doc Tutorials to give me this opportunity to talk to all of you. Thank you, guys. Have a nice day.